This is the female ward. The female ward is a ward where we admit all female patients, okay? Medical, surgical cases, whatever, we admit them in this ward. We have 27 beds in this ward, and most of the time it is also full. You will see what is happening inside. This is the inside of the female ward. As you can see, all the beds are occupied. You know, there are just a lot of patients here. You might be surprised to see some men standing here. These men, they came for one of their patients. So, for sure, the men also do come into this ward. But they are just visitors to see their patients. On the nursing station, we have our nurses, 2 nurses per shift. They are now busy looking after the 27 patients in this ward. How you do? Hi, Devele. Did it hurt you? Okay. Yeah. This lady was operated on Monday. I operated her because she had an acute abdomen. When we opened the abdomen, you know, there was just a lot of pus at the porch of Douglas. We drain it. She's still draining. She still has an NG tube. She is relatively getting better. But her condition was so bad the day she came out. It will take a little bit of time for her to recover because of the peritonitis she had. Yes. She's one of the patients we admitted due to a liver cirrhosis. As you can see, she's badly emaciated. She has this ascites because of the liver cirrhosis. We are so limited in this country that we don't have the facilities to check on all the possible causes. But one of the main causes of liver cirrhosis in this country is hepatitis B, okay, and sometimes drug intoxication due to herbal treatments and other substances. But her edema is gone. When she came in, all these legs were very much oedematous. The edema is gone. The ascites is getting better. Basically, we treat her with phenolactone and some of the other treatable conditions. This is the male ward. The male ward also has 27 beds. Here we also admit all male patients with different pathologies. Those for surgery, medical conditions, they are all packed in one place. One of our dreams in the future is to have a surgical ward. For sure, we don't have money by now to build a surgical ward. But this is one of our dreams for the future, so that the male, the female that are operated could be placed in one separate ward, known as a surgical ward, wherein more care could be provided and you also minimize cross-infections and other things. We will now take a look at the male ward and see what is happening there.
Thank you, sir.
Yeah, you are standing by the doctor. Yes, that's great. Thank you. The male ward is not completely full. You can see we have some few empty beds. Basically, we have all the different conditions here. Patients with liver cirrhosis. We have a patient of great interest that I will like to just say a little bit about. This young man, he was operated over the weekend with a gastric perforation. One of the common things we see here is typhoid perforations, and then we see gastric perforations. One of the things we've really noticed is a lot of people take a lot of NSAIDs in this country. There are a lot of combinations that people sell in the open market. A combination of diclofenac, paracetamol, sometimes brufen, aspirin. And people take these drugs just on the counter. They are not usually prescribed. And also people do smoke a lot, and people also drink alcohol. So we see a lot of gastric perforations in young people. And this gentleman, he was just a victim that he had a terrible gastric perforation, and we operated him 4 days ago. He is getting better, he is much stable, and these are just some of the challenges that we face here. This is the operating theater. This is the center where I worked together with Dr. Jeff. Our friendship started from this small room. Dr. Jeff came sometime in November to pay a visit. And we met in this operating room. And after working together for 4 days, just on the second day, he said, ABD, I would like you to come to the US and see how spoiled we are in America. Because when he came here, he saw how we were struggling to do surgery. No sophisticated stuff, no sophisticated materials. We have to do it by hand. Whilst in Europe, in the West, you have all the sophisticated machines. So I'm here to see all the sophistications, to see the difference between Africa and the US. Now we will take a quick look at the operating room and see what we do in this theater. How you do? This is the children's ward, the busiest ward in this hospital, because one of the reasons is we provide free care for all under 5s. So for that reason, the children's ward is full to capacity. We have only 27 beds in the children's ward, but sometimes we end up having 40 children. We double them per bed, which is strange. That doesn't happen in other countries, but for sure in some parts of Africa it will happen. So the children's ward, as I said earlier, is also a blend of surgical patients, medical patients. But basically what we see here is malaria, anemia, respiratory tract infections like pneumonia and other things. And this keeps us very busy. On the surgical side, we'll see a few cases of acute abdomen due to typhoid perforations. And interestingly, we see typhoid perforations mostly in children and in adults. Women, very, very minimal typhoid perforation, but more in men and in children. So now we'll take a look at the children's ward and see the work we also do in this department. You can see we have a lot of children with malaria, anemia, and a lot of them are receiving blood transfusion and other things. But there are 2 exceptional cases that I would like to draw your attention. My little friend here, Mr. Cargo, he's admitted, he was seen in the outpatient department sometime within the week, on Tuesday. Yesterday he was brought back. He's still having terrible fevers, and he was not passing stools. As you can see, the abdomen is distended with tympanic sound. We are considering, if he doesn't get better tomorrow morning, we will operate this child, because the titers for typhoid fever are quite high. There is no more malaria, so definitely something is wrong with his bowel. That is why he's having the persistent fevers. So most likely we might have to operate him first thing tomorrow morning. Furthermore, one interesting case.
Blood bank here. Like check.
They don't get the blood?
They don't get the blood, but the swelling.
Yeah.
I'm afraid.
Yeah, we need for open immediately.
Yeah.
This young boy had burns. They went to the village with his other brothers. They went to a farm. In the farming system in Sierra Leone, actually you brush, you fell down all the trees, then when they are dry, you burn the place to make rice farm and other things. So they went with his companions to burn the farm. They set fire, and accidentally he went back. So he got trapped in the midst of the flames, and he got burns. So he has a 2nd to 3rd degree burns on the legs, the face, and the arms. He has been here for the past 1 month. He is recovering now. One of the major tasks we have is to prevent contractures of the elbow and the knee joints. But basically the face is recovering, the hands are recovering, and they are all functioning very well.